Brazil is marked by stark social and health inequalities. It has a large population living in poverty, close to 23 million people, or 1 in every 10 Brazilians, while the other 1% of the population owns 49.6% of national wealth. Epidemiological research shows that social inequalities affect access to health. This means, for example, the very poor face more barriers to access health services, medication, healthy food, potable water, and safe sanitation. On the other hand, Brazil has a public health system called SUS, as well as government-implemented social policies such as conditional cash transfer, housing programs, and policies to protect the environment. But do these social and environmental policies impact healthcare inequalities in our country? The Center for Data and Knowledge Integration for Health, CIDAX, Fiocruz, Bahia, was created to study social and environmental determinants of health, as well as the impact of policies on the population's health.
Experiment, in some sense, that was created with the mission to try to explore the potential of the large data sets that are produced in Brazil.
The 100 million Brazilian cohort is an innovative product that allows the evaluation of social policies using individuated data.
The idea to using a databases in Brazil that compile more than 100 million people, near 60% of the Brazilian population is under this registration. And you use this register as the baseline of a larger cohort where you can study the effect of the different social protection programs on health.
The group, NIHR, Global Health Research Group on Social Policy and Health Inequalities, developed studies about social determinants of health. One of the main products have been the IBP, the Brazilian Deprivation Index. It is the first national measure that estimates the level of material deprivation in the smallest areas in Brazil, which is fundamental information for policymakers, researchers, and civil society. More than 500 downloaded requests of IBP have been registered thus far. CIDAX is part of a wide network of national and international research institutions to assure the integration of different knowledge and to support scientific and technological productions in the field of health. Now, with the NIHR Global Health Research Unit on Social and Environmental Determinants of Health Inequalities, a new research network emerged for similar analysis in Ecuador through a program of South-South and North-South learning and collaborative research. Some of the topics that drive our research unit are the evaluation of social and environmental policies and their contextual influences on health and health inequalities, analysis regarding how and to what extent health systems in Brazil and Ecuador can affect health outcomes and inequalities, and the development of an understanding of the temporal trends in social and health inequalities across Brazil. Our monitoring analysis and recommendations will be conducted by means of rigorous evaluations, and we will continue to work in close dialogue with stakeholders such as community groups and policymakers in Brazil and Ecuador. They will continue to participate in our public engagement activities, as well as in the Community Engagement Steering Committee to set priorities for our research and tell different audiences about our results, particularly policymakers. Between 2022 and 2027, we will strive to contribute with relevant knowledge for health research in Brazil, Ecuador, the UK, and globally through the development of training programs and the promotion of South-South learning.